Module 2, Lesson 2, CPR on an adult. So we're now going to conduct a walkthrough of performing cardiopulmonary resuscitation, aka CPR, on an adult casualty. The first thing that we need to do is make sure that the area is safe. I'm no good to anybody if I become injured myself. Electricity's turned off, whatever it may be. Please check and check again that your area is safe to work in. The next thing I need to do is establish whether my casualty is responsive or not. I'll need to speak in an increased volume, down, in both ears, gentle taps on the shoulders, see if they're responding to my voice, and physical stimulation. Can you open your eyes if you can hear me? Are you okay? I'm a first aider. Open your eyes if you can hear me. If there is no response, what I wish to do then is grab the attention of at least one bystander if available. Can you stay there for a moment? I might need your help in a minute. I now need to make sure that my casualty is breathing, or check whether they're breathing or not. Place a palm on their forehead, fingers on the bottom of the chin, gently rotate the head backwards, roll it back, lift the tongue off the back of the throat. This will give them an airway. I now need to place my ear right down to their mouth, look, listen and feel for breathing for up to 10 seconds. If they're breathing normally, we will talk about what to do in another video. If the breathing is not there, it doesn't sound right, don't know, doesn't sound normal, can't detect it, any of those, we treat the casualty as a non-breathing casualty. I now need to get my bystander to call 999 and say the following things to the operator. We've got an unresponsive casualty. If they're a child, tell the operator that they're a child. In this case, it's an adult. Unresponsive adult casualty. They are not breathing normally. We're going to start CPR. We require a defibrillator. I need to make sure that my bystander gets me or asks for a defibrillator or an AED, and I need them to come back to me when they've done that. Alternatively, 999 if there's nobody else available, speaker, and relay that information myself, but I mustn't delay starting chest compressions. Unresponsive, not breathing normally, chest compressions. I'm going to place the heel of one of my hands, the center of the casualty's chest, with the other hand interlock my fingers straight like this. I'm going to lock my arms out straight in front of me and using my body weight lean over the casualty and drive down into their chest about 5 to 6 centimeters, aka push quite hard. The depth needs to be 5 to 6 centimeters. The speed, I want to be aiming for 100 to 120 chest compressions per minute. That's roughly the tempo of Nelly the Elephant, Staying Alive, or Baby Shark, if it helps you to remember. Now I want to give 30 chest compressions. After I've done 30 chest compressions, I can now give my casualty rescue breaths. So remember, they need an open airway. Palm on the forehead, fingers on the chin, roll the head back. I need to gently pinch their nostrils, get my mouth around theirs. Now, if I've got some protection equipment, a face shield that can act as a small barrier, they're available in first aid kits, or you can order them on a roll to go between our mouths, fine. Please use it if you've got it. Open airway, pinch the nose, my lips around theirs, blow 1, 2. All the chest needs to do is inflate slightly. That is a normal breath. Do not overinflate your casualty. You don't need to. So 2 breaths, I've oxygenated the blood. I now need to go back to the chest. Hand, interlock, lean over, drive down for 30 chest compressions. In and out is 1 chest compression. We don't need to press too hard or it's not effective. So 30 compressions to 2 breaths, 30 to 2, 30, 2. If I get tired, grab a bystander, tell them how to do it, tell them where to position their hands, count them through the process. I can get somebody else to hold the casualty's airway open for me. It's all about teamwork. I'm going to continue this cycle until the casualty shows a significant sign of recovery, at which point we roll them on their side. The paramedic arrives and specifically gives me an instruction to stop, or it becomes unsafe for me to continue. There's a threat to my safety. I'm injured, I'm fatigued, I have to stop. 30 compressions to 2 rescue breaths. We start CPR as soon as we acknowledge that they are not responsive, they are not breathing properly. An ambulance needs to be called. We're going to do CPR to bridge the gap until they arrive.